Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
September is Sickle Cell Awareness Month. That's our topic for today. What is sickle cell anemia?
It's a genetic disease that affects a particular protein called hemoglobin, and this protein is present in red blood cells. And what happens in this disease is because there is a genetic mutation, the hemoglobin, and the red blood cell has a certain shape. It's a disc-shaped organelle. But when there's a mutation in that protein, hemoglobin, the red blood cell takes on this weird shape which looks like a sickle. And that's why the disease is called sickle cell disease. And that becomes problematic because the red blood cell can get stuck when it's moving through the body, through the capillaries. And also because the protein, the hemoglobin, is mutated or changed, it doesn't do a good job of carrying oxygen to all the organs in the body.
So Dr. Raja, one of my close friends actually has sickle cell, and for the past week she's been in the hospital with one of the crises. So what are the symptoms?
So the crises that you speak about, so that is referred to as a pain crisis. So usually what happens most commonly is when someone has this disease condition, they go through these episodes of pain. Again, just simply because there isn't efficient transport of oxygen to a vast variety of organs. So they'll have a lot of pain conditions, so they'll have to go in and out to take care of the pain or treat the pain. In addition to that, though, there are a lot of other problems that can happen because if you're not getting oxygen efficiently to your organs, so people end up having problems like lung problems, kidney problems, anemia. All these things can become complications of the disease.
How is it inherited?
Since it's a genetic disorder, it's inherited from the parents. And usually what can happen is if someone has sickle cell disease, that means they got both problematic genes from the two parents.
What complications can come from these pain crises?
Right, so the pain is the most common symptom, but if this goes on and it's not treated, organs get affected, and therefore the real complications become things like problems with the kidneys, problem with sometimes even the brain, and a series of these become the much more serious issues.
What treatments are available to help manage sickle cell?
Because there are variations, there are different types of treatments available. So the basic ones would begin with trying to help or ease with the pain. So the pain medications will come first to help someone bear or deal with the pain. Then comes things like blood transfusions, because the blood isn't, or the red blood cell in the blood isn't doing the efficient job of transporting oxygen. They'll try to do blood transfusions to aid those patients. So there are multiple layers of treatment. So it's just a question of what the individual is facing that they'll then cater the treatment appropriately.
How can bone marrow or stem cell transplants help?
Bone marrow or stem cell transplant is actually the potential curative therapy. So you could, basically what you're doing in those cases, you're literally kind of replacing the red blood cells. You're taking out all the defective red blood cells and replacing it with, to put it in very simplistic terms, you're kind of replacing it with new and appropriate, proper red blood cells.
Thank you, Dr. Raja.
Thank you, Madison, and I hope your friend recovers soon.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.